All right, welcome. Today we are going to go over personal statements. Just a quick overview of what will be discussed today. We'll have some quick introductions. We'll talk about brainstorming, how to organize your personal statement. We'll discuss overall narrative, do's and don'ts, some additional considerations as we get through it, along with final tips. And to start, we'll go over a couple of introductions. I'll hand it over to Jade and round us out.
All right. Hi, everyone. My name is Jade Frame. I am the Associate Director for Pre-Health Premed. So I work along with Ron, with about 10,000 of you, give or take, to help guide you in your career goals in the healthcare field. Just a little bit about me. I've been here at UCSD for about 3 years now. My anniversary here is coming up, I think, January 18th. So 3 years. Before this, I was at a community college. I received my master's from CSUN in counseling with a specialization in higher education. And before that, I was a UC grad, so UC Riverside was my school, and I was a neuroscience major. So that's a little bit about me, and I'll hand it over to Ron.
All righty, thank you for that. So I, Ron Reyes, am or the other advisor for HealthBeat. My background is a little interesting. It's been higher education for some time. I just hit the 3 year mark at the Career Center. I had been with the UC for a little over 5 years. In my previous experience, I also was at a campus where I handled a lot of admissions and advisement for a nursing program, as well as had previous experience at admissions. So I'd say I have roughly around 12 years admissions experience. So for me, personal statements is a very important topic. And besides that, I also have a background in human behavior, and my undergraduate was at UC Santa Cruz. So we're both UC alum. All right. So before we get into everything, just a quick reminder for those both watching this and in the presentation, we are HealthBeat as advisement within the Career Center. So we handle a lot of resources for pre-health students. As we mentioned before, there's about 10,000 of you. So we always want to make sure that you are following us on Instagram, utilizing the website that has a lot of the data that is useful for students applying, as well as making sure that you have different tools at your disposal. And then just real quickly, you can pull it up both on mobile as well as on your browser. And then depending on the profession we're talking about, we have 9 categories of professions we usually get questions on. So we just list them there as medicine, dentistry, pharmacy, PA, optometry, PTOT, veterinary, public health, as well as nursing. So digging into everything, what is a personal statement? Well, we do have a definition, a short essay that highlights the best qualities of the writer, usually in the context of school or job applications. It's a personal essay that delves into the talent, skills, passion, ambition, and accomplishments of the writer. So this was taken from Grammarly, and really it is an opportunity for us to talk about why that particular subject is important to us. So for a lot of times with personal statements, we're talking about showing different elements about us, right? So we're talking about our motivations for the profession that we're applying to in the context of healthcare, what our values are, and how does that fit with this career? What is our capacity to do well in that environment? What are the things about our personal history that shows that this is something that we can grow with, right? As well as hopefully, if this is something that is super important to us, what's our vision for the future? How do I see myself in this profession and being a professional in my future interactions in healthcare?
So now we're going to jump into kind of the nuts and the bolts of a personal statement. We really wanted to start off with a mission statement. Okay. So before you get started, develop a mission statement, and we'll give you an example in a second. The mission statement includes your values, vision, and your goals for yourself as a professional, and really an overall way to express your why in pursuing medicine or whichever healthcare career you are applying for in this case. So an example is as a future physician, my mission is to provide compassionate, evidence-based care that empowers patients to make informed decisions about their health. I am committed to lifelong learning, upholding integrity, and advocating for equitable access to healthcare, particularly for underserved communities. So, this is a mission statement example, and we'll break it down into its key elements. So, the first part or the first key element of a mission statement are values. So, this is which principles guide your actions and decisions. In this case, it's compassion, so providing compassionate care and showing empathy, integrity, which means really a commitment to honesty and ethical practice, and really just building trust with patients and colleagues. And last is equity. So, in this case, advocating for equitable access, which shows a commitment to fairness, social responsibility, and it is important to in addressing disparities in healthcare. Next, we have vision, or what long-term impact do you want to have in your field? In this case, it's empowering patients to make informed decisions. And then last but not least is goal. So which specific outcomes are you working towards? In this case, it's a focus on underserved communities, which suggests a goal of working in areas where healthcare access is limited. You can even be more specific because a goal is a specific outcome. Maybe you could include which type of communities you want to work with. Maybe it's geriatrics, maybe it's pediatrics, maybe it's non-English speaking communities, maybe it's refugees, right? So these are just some ideas to throw out. I did want to give you all a tip as well. You can use the AAMC 17 core competencies to help guide your mission statement. There are professional competencies on there as well as science thinking, reasoning competencies. For example, the lifelong learning, which is in the mission statement. So just going back really quick, um, I'm committed to lifelong learning. This is actually a 17 core competency or one of the 17 core competencies. So you could use that to help guide your mission statement. And the reason that we start with this is because we really want you to have a solid foundation or a launching point to write the rest of your essay when the medical schools or the graduate schools, in whichever case, are looking at the personal statement. They're looking to see what your theme is. They're looking to see what your values and your vision are and how you've developed as a professional and a human being. And so for you, if you are able to write this out and really use this almost as your thesis statement in your personal statement, it really guides the rest of what we're going to be talking about today. Okay, so this is a just very strong starting point before we get into the other nuts and the bolts of your personal statement. So once you have your mission statement, you want to brainstorm your talking points. Okay, so pivotal experiences, important activities, maybe challenges that you've overcome. One of the 17 core competencies is resilience or grit, right? So it's really good to talk about maybe some challenges that you've overcome, maybe some impactful mentors, and like we said, those core values. So you can brainstorm all of this, and this can actually help you write your mission statement, right? So it's more or less in this order. Next, you want to then organize your thoughts. Okay, so from there, you're going to start to summarize in short paragraphs. I would throw everything onto your essay because this is brainstorming, right? You want to throw as much as you can that you think is relevant because you might not use everything. We'll get to it in a second, but you'll start cutting down. Consider important moments that you want to include. I would say organize chronologically or by time, right? Most I guess least recent to most recent, I think is a great way to organize and then see what pieces work together. Now, I will give you a caveat. You may not keep it chronological, which we'll talk about in the narrative format, but you want to start chronologically just to keep yourself organized. From there, you want to make sure that your experiences that you write about in your paragraphs follow a certain formula. Okay, so you want to describe your path to that experience that you're writing about. So maybe it is working as an EMT, right? So you want to describe how you decided to maybe get your certification and then get a job, maybe why you pursued the experience. Maybe it was because you wanted to work in a fast-paced environment. Maybe you wanted to work in a certain area where the ambulance generally goes, right? Then you want to detail maybe how you felt during the experience and then define what you accomplished and learned. So every experience that you talk about should follow this formula. Also, you want to show and not tell. So, what does that look like? So, for example, someone may say, I used my communication skills in empathy and compassion. Instead of telling what you did, you want to show. So, I brought patients extra blankets and remembered what they cared about the most, and it made all the difference, right? So, you're showing how you displayed empathy, compassion, communication. Next, another example, I saw many patients and their families from different backgrounds. So you're kind of telling what you did versus showing. Working with over 100 families within over 2 years within blank community, helping me understand blank challenges. So you are very specific in what you've learned, and so you don't have to say, "Oh, I am multiculturally competent." You don't need to say that verbatim. You show how you are multiculturally competent. You show how you have displayed empathy. So these are now kind of the elements. So first you have your mission statement. You're moving into brainstorming, getting your paragraphs together, making sure your experiences follow this formula. And also, when you are talking about your experiences, you have qualities that you're showing as well within those experiences, like I said. So maybe it's the empathy and compassion we talked about. Maybe it's leadership or maturity or sincerity or communication, whatever that looks like, right? So these are just some example qualities. This is by no means an exhaustive list. There are more that exist outside of this, but this is just a good place to start. So once you have all of that, you've written out your mission statement, you define your values, your vision, your goals, you started to chronologically write out some experiences, you have described your experiences and some qualities, you showed and not told what those experiences look like. Now, what you can do, and I kind of touched on this earlier, is organize it into a narrative format. Okay. So, the Purdue Online Writing Lab says when writing a narrative essay, one might think of it as telling a story. These essays are often anecdotal, experiential, and personal, allowing students to express themselves in creative and quite often moving ways. This is a chance for you to tell a story. So, I'll pause here and say kind of what I see and what I prefer. So, sometimes I see when you're applying to graduate school, we'll use medical school as an example, they give you prompts. They may want you to answer certain questions. And so you could absolutely write and answer the prompts and you'd be answering the questions, but it's not as capturing as maybe you open your essay with an anecdote and then you talk about your mission statement and then you talk about all of the things that led you to that mission statement. That's just going to be more impactful than simply answering the prompt. So I don't want you to answer the prompt. You can definitely use that as a brainstorming piece. I don't want you to answer it and use that as your structure, I guess is what I mean. But you can absolutely definitely answer the questions, but you want to answer it in a narrative format. Okay, so for narratives, you can have like an intro paragraph, a few body paragraphs, maybe three, 2 to 3, in a conclusion, which is generally one paragraph, and consider how each connects. Okay, so you can organize it this way, but it does not need to be chronological. Whatever makes sense to your narrative. You're always going to start with your mission statement. So, in the case of providing evidence based care and working with underserved communities, maybe it makes more sense to talk about something that's more recent, that was more pivotal for you. And using that as the start of your essay after you talk about your mission statement. So it might not be chronological, right? Maybe it does work for you to talk about your childhood. Maybe it was a pivotal experience you had in the hospital yourself. And that was a launching point of how you really wanted to get into medicine. It's not necessarily chronological, right? You might jump around from back when you were a child to maybe an experience you had in college because it helped you learn a value. And then you jump to another point in time that helps you describe a value or a vision that you developed as part of your mission statement. I would go that way instead of just trying to chronologically write and trying to answer the prompt verbatim. Okay, I'm telling you, I've seen multiple personal statements. The ones that look the best, are most impactful, are the ones that really describe someone's why, someone's narrative, someone's mission for their life, and how they got to that point. So I hope this has gotten through. And then last, you just want to put the pieces together. So you've brainstormed, you have your mission statement, you've written out all the key elements you've shown and not told, and it's looking good. So now you just want to make sure it's organized, put the finishing touches. Maybe there's more impactful moments because Ron is going to also talk about how many characters you might be able to have. So you're not going to be able to leave everything on there. You want to make sure it's organized in the way that makes the most sense. Does not need to be chronological. What makes the most sense to what the point that you're trying to get across, i.e., your mission statement, or your really it's your thesis statement at this point, right? Because it's the fulcrum on which your essay is swinging on or hinging on. You want to think about the key elements, make sure you have those in there based on your mission statement, and see if everything fits together, right? So you see why we want you to start with the mission statement because everything always should come back to that thesis or that mission, everything you talk about, okay?
All right. So now that we've gone over that, we're going to go over some do's and don'ts. By and large, this is not a comprehensive list, but is a lot of things that we've seen that can really make a big difference in how your essay is read, right? So one thing that we say a lot is, don't restate a resume or application information if you can avoid it. And that being is, your personal statement is who you are, your values, and those specific elements that inform and help us understand that. Some of that may have some of those experiences that you've had before, but not necessarily, right? The personal statement is our golden opportunity to utilize everything at our disposal about ourselves. So hopefully the rest of our application can focus on things like our works and activities and other areas that aren't necessarily primarily just about us, right? So we try and keep that separation where personal statement maybe are all the things that can exist outside of a works and activities because it's really about understanding our journey and our starting point. The other thing is, don't use a lot of cliches, anecdotes, and jokes. We can use a little bit, right? Restraint. You can use it maybe as a way to bring them into the essay, or if there is a specific anecdote that is really a perfect kind of segue into something key about you, then I would say it would be okay. But we have to be very mindful about that. Again, I'll go over a little bit of space and timing where, if we have too many cliches, jokes, or anecdotes, it might not give us enough room to really talk about those key important elements that we need to get across. So we want to make sure to keep focus on our values and why we are doing this, and anything that we add above and beyond that is really more of a complement, not a primary component. The other thing is be careful of tone. Uh, Understand that this is going to be read by a wide variety of people. So be mindful of slang, be mindful of how you address working with different groups of people. I know some people might not understand that if they're talking about an underserved population, be very mindful about how we talk about an underserved population because there are certain language that could sound a little problematic. And, if we're meeting with you, we'll go over that, but it's always good to read it out loud and have a lot of different people read it out loud so that we can kind of double check and catch that. Try not to be overcomplicated. I have sometimes read personal statements where it looks like somebody went through the thesaurus app and just plugged in a bunch of fancy words. That gets distracting, right? So we want to not overcomplicate the language we use. It should still stay relatively true to how we would want to communicate in general with people we interact with, but just be mindful of, you don't have to use a fancy word for every single thing. Maybe every now and then, if that's truly how you like to communicate, that's fine. But just keep that in mind that, again, this is being read by a wide audience. Hopefully, the last thing is obvious. Please don't plagiarize. It's also why we don't have students review full length examples because there is a habit that if I review enough of these, I'm going to start copying what other people have done. We don't want to do that, right? We want it to come from the self, be self-generated, reflect your actual voice. And so please avoid formatting and trying to expect that you have to deliver something similar to somebody else, right? So don't plagiarize. Whoop, did it not go over my do's? Okay, some do's. Focus on the key aspects of your journey. Like we mentioned before, it's all about really knowing what you are going to highlight. Write in first person, talk about yourself as I. Be truthful and accurate about your experiences. You do not need to over embellish anything, right? Sometimes simple actions speak louder than something complex. So be truthful and accurate about your experiences. We've mentioned this again before. Always get feedback, have other people read it out loud, and revise, edit, spell check, grammar check. That is going to be something that you are going to do multiple times in the process, right? Especially as we're making edits. Sometimes we'll assume something still exists in an essay that isn't there anymore. So you want to always be reviewing and double checking both the language, the content, and grammar so that it flows as you read it out loud. All right. So some example lengths of time. So AAMC and ACOMA, so MD and DO applications are 5,300 characters. They are the most robust amount of characters in comparison to some of the other healthcare professions, right? Texas and PA sit at about 5,000, so just a little bit shorter than the MD and DO. I say Texas because the TDMS covers a combination of healthcare schools for Texas only, but it is a very similar CAS application process. The next ones that are a little bit smaller are pharmacy and dentistry, sitting at about 4,500 characters. And then I'm very sorry, veterinary, but we only get about 3,000 characters for our personal statement. So we have to be really, really thoughtful about what we are saying. And this is where that anecdote probably has to get taken out, right? Because we have a couple thousand less characters. So they really just want to get to the core values and why is this important, right? So character length and what we're applying to can affect how we summarize and condense our personal statement. But I want to put that out there because it is an important factor in the editing process. So some additional considerations that can be helpful while we're going through all of this. Oops. Think about what compels you to this profession and have you talked about that, right? So after I read my personal statement, did I cover that? Why am I doing this? Does this demonstrate potentially the distance traveled, as in were there challenges I got a chance to talk about working through, or were there things in my personal history that really showed growth, right? Capacity to grow. Um, is there, speaking of challenges, other things that either cause gaps in your experience or education that you were able to address? Were there ways that you figured out how to do something so you can show resiliency and grit when things got difficult or you overcome a major challenge, right? Those defining characteristics and elements can really shape the understanding of who you are and the narrative of where you've come from and where you are going. And then the other thing is, like we mentioned before, reflect on through my personal statement, am I able to demonstrate some of these core competencies I've developed through the process, right? Uh, we, I always say, no experience is wasted if we really take the time to think critically about what we've learned from it and how we've grown. As long as we are doing that, then there is always an opportunity to find where these experiences exist and how they relate to things like core competencies. So, just to sum it up, this is a process. It starts with a mission statement or thesis to really think about who you are and the narrative and the story behind the applicant, right? And then when we're thinking about the profession, there should be a fit, right? Values alignment. And then once we have our narrative, we have our different components, we see how it all fits together, go through and refine, right? So we're going to revise, edit, ask for feedback, commit to the process, revise, edit, ask for feedback, and make sure that it really is communicating key aspects about ourselves and what we value. So, it's not a one and done. but it's a process where we're really making sure that we're putting our best foot forward so that whoever reads it really understands who you are and why you are applying. And with that, that is our presentation.
Thank you.